my name's Justin Peters and I graduated from the Formulation Science course in 2005. Now I'm currently working at Sigma Pharmaceuticals in Dandenong, where I've been for the last 2.5 years. So I thought I'd share with you a bit about my story and how I came to be in the position of Contract Account Coordinator. Alright, so first of all, why did I choose Formulation Science? I guess when I was at high school I was always interested in the science subjects, and I also kind of just liked helping people out. So I thought, hey, I may as well combine the two together and be a pharmacist. So I entered Pharm Sci with the hope of being able to transfer into pharmacy after first year, which, like a lot of the other students in my year level, well actually all of them, none of us made it through, because being first year at pharmacy college, it's quite tricky. And yeah, so I had to change study habits a lot from year 12 to first year uni, and anyway, didn't work out. So I thought after first year, I did enjoy doing first year Pharm Sci, I may as well stick it out and just see where it leads me. So yeah, so I ended up finishing the degree. At the end of it, a lot of people in my year level wanted to do honours, but not me. By that stage, I think I'd had enough of study for that time of my life. So I actually decided to take a year off after uni and kind of pursue some of my musical ambitions, because I like singing. So yeah, I took a year off, worked in retail, did a few musicals, and at the end of that year I got a call from a girl I used to go to school with saying there was a position available at Sigma. So yeah, the money was good. I thought, hey, I probably should use my degree now. So I grabbed hold of that opportunity and went for it. So I started off working at Sigma in, when was it, 2006, end of 2006. And that involved, it was a QA role doing cleanliness inspection, so pretty much making sure that equipment had been cleaned properly after it had been used in manufacturing, so that for the next kind of manufacturing lot, there wasn't any contamination. Like, yeah, it was inspected properly. I pretty much did that for 6 months, and then an opportunity arose at Sigma again for a permanent within Sigma position of QA Associate Product Review. So once again, I thought, yeah, this sounds good, I'll go with it. Yeah, and that involved, I was there for 18 months doing periodic product reviews. So at Sigma, they make hundreds of different products, and it's strictly not part of GMP, but it's a good practice for a company to make product reviews so that you kind of can analyze trends of products. So you look at all different QC, stability test results, see if there's any particular trends, if we need to kind of flag something and say, hey, this doesn't look good, we should probably investigate and try and fix this product. Because ideally, as you probably learnt, all processes in the pharmaceutical industry especially need to be proven and robust and reproducible. You want to be able to make the same product each time you make it. So yes, product review is a good tool to make sure that everything is kind of on track and that you're aware of the trends instead of just looking at things isolated batch by batch. So this gave me a really good oversight or overview of the pharmaceutical industry, because I was looking at everything from batch documents, specifications, QC, stability results, customer complaints, validation reports. So it really gave me a good feel. But being a QA role, it kind of was a bit, I don't want to put down QA because QA is quite good, but for me, there probably wasn't enough interaction. QA roles generally involve a lot of documentation, thorough review, identifying problems, investigating. So I guess I like the problem-solving aspect of it, but yeah, I like to be around people a bit more. So a new position popped up at Sigma, which was Contracts Account Coordinator role. But before I get into that, I'll just tell you a little bit just about what Sigma is. So they're a pharmaceutical company, Australian owned. We've got 4 main manufacturing sites, so one up at Queensland, one in New South Wales, one in Croydon, and one in Dandenong. Dandenong is the biggest. We've got both a solids and liquids facility. In the solids we make tablets and powders, and we pack the vast majority of them as well. Some customers just want bulk tablets, they can pack them themselves. We've got a liquids facility too. At the liquids facility, we make creams, ointments, lotions, solutions, syrups, drops. So a whole big spread of all different products kind of thing. So I guess by doing pharmaceutical science, you will be introduced to a lot of the different dosage forms, preparation types, etc. So to have this background knowledge is quite important when you're in the industry, because once you're already in the industry, you kind of don't really get shown all the basics on a technical level. So it's kind of, it's almost like assumed knowledge. You can always do your own research, but technically it's not part of the job itself. So it's really good to have a good heads up on all this information. So make sure you're paying attention to all your lectures, because you never know what you'll use when you get out into the big world outside. So that's a little bit about Sigma. My current position as Contracts Account Coordinator it pretty much involves a lot of project management. So a lot of the time I'm designating activities for people to complete and making sure they get completed within a certain time frame. So there's constant reprioritizing, constant chasing people up, cracking the whip kind of thing. So not all Sigma internal departments like us contracts people, because we're the guys that kind of, customer is our main focus. So if the customer has a request, we need to make sure that it gets done. So that's our priority. So we kind of need to be the voice of the customer. It makes life a bit interesting. It's quite good. So you need to kind of deal with a lot of conflict management. So because sometimes the customer demands aren't necessarily in line with what Sigma wants to do. Because you've got a position where with contract manufacturing, Sigma makes a lot of products for themselves and sells them under the brand of Sigma, Amcal, Chemisone, Guardian, Heron, but we also make a lot of products for other pharmaceutical companies, and so the outer packaging will just be branded as some other pharmaceutical company, like for example GSK. So that kind of means that these companies that we make stuff for, they've got their own set of global standards or national standards that they kind of half expect us to kind of conform to as well. So it places you in a situation where you've got all these kind of special instructions and arrangements that are customer specific, because most of Sigma's standards, they meet GMP, so they cover the vast majority of our customer work, but certain customers have specific requirements. So you kind of need to it's a balancing act all the time, and a lot of it is common sense, but it's kind of something that's a bit of a challenge, and that I enjoy doing. So it's a very customer service orientated role. You've got lots of different personalities you work with, different levels of management, demands. I guess I don't really have a normal day-to-day routine, because there's constantly different customer requests that come about. Some of the types of things that I need to keep the customer up to date with are things like new product introductions. If they're introducing a new product to Sigma, I need to make sure they've got all the relevant documentation, everything's sorted out, and that everything's kind of set up properly before we release, because that's probably the trickiest bit, where something is not already in a system is not in place. You kind of need to kind of make that system happen so that everything kind of just runs smoothly from the first, and hopefully all the rest of them kind of thing. You need to also update the customer about product delays, because not everything runs on time. Regulatory changes. This is something I didn't really learn that much about at uni, the regulatory side of things. I guess it's like all the different TGA laws, rules that are kind of in place that need to be adhered to. I guess if you're interested in doing everything by the book and having rules that you've got to kind of follow all the time, then probably Reg Affairs would be a job that you might be interested in. So that's one other aspect. So that's something like regulatory changes. If you're changing the supplier of raw material from one country to another, you need to make sure that all the required regulatory steps are taken. If you change manufacturing site from, for example, our Balcombe Hills site in New South Wales to our Dandenong site in Victoria, then there's all regulatory implications involved with things like that. And just general changes that happen to the product. Products are always changing, like you've got changes in artwork, so the way the carton looks. You've got changes in maybe the batch size. You've got changes in raw material sources. The list goes on. It's always forever changing. You might just think, hey, there's a product there. It's been in the market for ages. It's a grandfather product. I don't need to change it, but constantly, there's always constant change and dynamic atmosphere.